the basic principle of the exam is they're looking for a safe surgeon. The first thing is they want to see how safe you are, how much empathetic you are towards patient management.
Exactly.
Knowledge, definitely they
Yeah.
expect you are a consultant level exam, so you are expecting that they expect you to have all the basic knowledge.
Yes.
But the only thing
Yes.
that makes the difference is how you approach the question, like the first few words that you utter from your mouth, like when you have to
Exactly.
be apologetic, when you have to show empathy, and
Exactly.
when you have to
Exactly.
take consent properly. So all these things, I think the
Yeah.
international students, because see, it is assessed both in the international and the UK exams. But the problem is in the international exams, the candidates are not that much prepared mentally that these things will be asked,
Yeah.
and they are
Exactly.
not in their UK practice. So this is very common for someone who is in UK practice. So that is what our whole focus
Exactly.
has been, to bridge this gap between an international and a UK based
Yeah.
exam.
I completely agree. In this exam, my suggestion is don't think UK is another planet or something like that.
Yeah,
UK
exactly.
is part of the globe. Don't overthink too much. And another, so there were many more interesting things. So, for example, and I discussed this with many senior examiners as well. So, the difference between UK trainees and international trainees, when they start answering the question, it shows immediately within first 2 minutes that they
Exactly.
are not UK trainees. So the
Mm-hmm.
examiners know immediately, but they try to not look at that fact. They still
Right.
try to accommodate. They
Mm-hmm.
understand that you are not a UK trainee. So, for example, all the UK trainees would kind of start their answers in a particular way. So, for example, if it's about examination, all UK trainees will say, "I'll consent. I'll examine the patient with their consent, in presence of a chaperone, in a relaxed environment with comfortable light." And they will sometimes go like this.
Mm-hmm.
While none of the international trainees start their answers usually like this. Now, I, for all my answers, actually said that I would, in examination, be interested in looking for these findings. I didn't say what the UK trainees say at all, but the examiners did not, I think, penalize me for this.
Mm-hmm.
And except for one examiner, because it was a female urology section. So in the female
Mm-hmm.
urology section, consent and chaperone are obviously important. So I didn't mention that. I just said what I always say, because I think, to my mind, it's implied, but it's not. So for some stations, consent and chaperone are important, like female or pediatrics. For pediatrics, is essentially with parents, with chaperone, whatever. But for others, the examiner actually told, when I discussed this later, that I didn't say this, will it cut any marks? So the examiner said, no, it bores the examiners.
Mm-hmm.
So cut to the chase,
Right.
be crisp, be sharp, and like you in your course, you wonderfully explained that within the first 2 minutes, get the basic things out of the way. So the basic points in history, basic points in examination. Please
Mm-hmm.
time it right. What international trainees get wrong is they spend 5 to 7 minutes just on basic history and examination,
Yeah,
and the
I'll
examiner
add
may
here.
not stop you
Yeah.
sometime. Yeah.
Yeah, I'll add here one point. You said that the international trainees, they forget about the consent. I think they previously there was a trend that they used to forget about the consent and the chaperone.
Yeah.
Nowadays they remember it. The
Yeah.
problem is they remember it so well that they
Yeah.
keep on talking about that for a long time.
Exactly.
They
Yeah. No,
keep
I
on
didn't
staying
remember.
to the examination for 1.5 to 2 minutes, and the details, the higher
Exactly.
discussion. The whole exam is how
Yeah.
it's a high level of discussion between a consultant versus a consultant. So I think two consultants should take
Exactly.
it to a high level of discussion very soon. Within 2 minutes, you should
Exactly.
go very quickly to
Exactly.
the highest level
And
discussion.
and and I always say that for each station, prepare an opening gambit, which you wonderfully teach in your course, that there should be an opening gambit, your SRAM queue and everything. So it covers that. And try to bring at least one trial in your discussion.
Yeah.
Try to take it there. And don't dig a grave. So this is the most common advice all trainees in the UK are given, that don't dig yourself into a hole.
So how many
And
months
I
did you
just hope
actually spend time in practice? Like when did you decided to
I
give this?
I for part one I did read for 1 month properly, and I took 7 days break before the exam. But
Okay.
this is me because I'm a consultant and I do know my field, although I may not practice much of it, but I do know. For a regular trainee, I would say give yourself at least 3-4 months for part one if you know your job well. If
Right.
you are really a trainee just out of training, maybe more. But in part one, so there is a strategy to this exam. So this is also important that don't read Campbell for this exam. I mean,
That is
don't
what
don't do
very important point that we have been talking a lot, that that's
that.
an American association based book, so that is not
Exactly.
followed at all in the UK and the Europe. So it's mainly an
Exactly.
Oxford and European guidelines that's mainly picked up in the exam.
Yes. Yes, and for the first time when I read the Oxford Handbook, and I was thinking, why this is such a small book? How can they ask from this? I
Right.
mean, for
That's the
us
feeling.
Indians, we
And
are
that's the reason why most of the
exactly.
candidates ignore Oxford. They think that we have read Campbell and our knowledge is more than Oxford. But the data in Oxford is not at all similar to
uh,
what is there in Campbell. Concepts is good in Campbell. You
exactly.
uh,
Yeah, I'll be honest. So I actually so when gave the part one the first time, I only read for 10-15 days honestly, and I thought when somebody told me that you don't need to read Campbell and everything, you just need to read few things. I actually discounted it. I thought he's lying, or maybe I don't know. How can that be that you have this exam and you have to study not Campbell or something like that? And when I gave the exam, so the first attempt for my FRCS part one, I failed by 2 marks. And that exam had the lowest pass percentage in history of FRCS. So only 48% students passed that exam. Normally 60 to 75% students pass. And when I came back from the exam, I was thinking to myself, I finished the part one exam 1 hour before. You know why? Because they had asked so many percentages and particular things that either you know or you don't know. And when I came home, I told this to my examiner, so to my boss, that they were asking things which did not need me to think. And I thought that,
exactly.
why? I mean, I can't think through this. So I just wrote what I felt and came back, and I failed by 2 marks. But when I read the result, then I realized that I was in the 50%, in the top 50, I would say, at the 50% mark, and 50% students had failed. So I knew I was in the top 75% because normally 75% students would pass. So when I came back, I said, okay, now I know there is a strategy to this exam. I need to read particular literature. I was completely inexperienced, yeah. And then I figured it out. So when the second time I gave my part one, I was in a revenge mode. I said, I will do very well.
Great.
So I
Great.
went. But yeah, I went and I had like 40-50 marks extra in each station. And I actually got 90% score, I think, in part one.
Yes.
So
Great. Great. So the problem is the lack of guidance. I think most of us at that
exactly.
time, probably you appeared 2 years back, right? Part one. When was the
Yes,
part?
yeah. So this was last year. Part one was last
Okay,
year, two
last.
again.
So,
Yeah.
the lack of guidance, I think, is the problem. So that is what we are trying to
Yes.
always say. Everyone
Yeah.
that read Oxford, try to put emphasis on Oxford, scientific
Exactly.
basis. All those are important,
Yes.
valuable books followed in UK. And
Absolutely.
one more thing, we have this on the right hand side. Can you identify what is there on the right hand side of the screen?
On the
So we have
right
on the
hand
left hand
side,
side
it's
we
your
have your,
score.
yeah, on the left hand side
Yeah.
we have your actual exam score. On the right hand side we have the mock exam score, which is almost the same.
Oh
We
yes.
predicted,
Yeah.
we
Yeah. Yeah.
predicted 5 days
Yeah.
before. We predicted 5 days
I
before your
have.
exam that you'll get this score, and we almost got the same score. So how was your mock experience?
Oh, oh yes, it was wonderful. So your mock exam was so great, and it was so detailed feedback, and it helped me. The scenarios I got in the main exam were slightly different, but the feedback that I got, it actually helped me prepare. So, for example, in the mock exam, when you asked me about bladder mass, and in my practice, I don't do RT-URBTs because we are experienced surgeons. We always have muscle in our specimen, almost always. So we only do VT or VT in very infrequent scenarios. Now I forget when in an exam someone asks me
Exactly.
bladder mass, yeah, I would say T1, BT done, T1, C3, whatever, BCG. So, but as a trainee, you would need to say VT, and you pointed it out. So when in the exam, I was actually asked, and I was like, oh yeah, I know, I need to say VT or and the feedback really helped. I'm so amazed by the accuracy of your mock
I
test.
was just going
It
through it.
was
Even I forgot your score. Like there were other candidates also. I took the mock exam. Then I
amazing.
got your actual score and compared. Okay, it's almost the same. Great achievement. Great.
Oh God, it is so amazing. I mean,
So
I'm happy that I just passed. I mean, I was not looking to get a gold medal.
so
It
you
was not
passed
my
in.
aim.
So this was your first attempt for section two.
Yeah, first attempt. But
Great,
this
great,
time because I had experience about part one, and I knew that UK needs its own set of training and the way you approach.
great.
So, and
That's
that's why I booked your course. When I saw your advert for the first time, and because what happens is in UK you will get mock vivas which are only for a day.
right.
And that's not enough. That's not, and plus they are super expensive. They will charge you 300, 400 pounds just for a day of training. And you may get validated or come back thinking, oh, I don't know anything, but you don't really grow there. But your course, you go in detail about every scenario. While in a mock exam, you will just face two scenarios per station and come back, right? You might see another candidate viva two scenarios, so four at most per station. So I suggest that people should actually consider doing your course,
Thank you
and
for your
because it's
feedback.
very
Thank you so
detailed.
much.
Yeah,
That you
it's
that you actually
yeah,
found
it's
it very useful, and that is our whole purpose. Is we
yeah,
I think there is one more course, but that is also for 1 or 2 day course. There is no we the
yeah,
whole purpose is to make it totally detailed
no,
discussion and let us take up every topic and
exactly,
grind it into pieces and let us absorb
exactly,
every piece of it so that we don't miss out any
exactly.
station in our exam. So
Yeah,
all those who are
yeah.
going to appear in November, the next exam is in November. What is your advice for them?
So again, if it's part one or part two, what we
No,
are
it's
talking about.
section two. Section two. November section
Section two,
two
yes.
and January section
Oh
two.
yes. So I for my Viva, I just had your screenshots, which I was revising before going into the room. So I think your course is enough. I do expect that candidates would have the common sense to obviously read a bit more widely because you just can't go with what is the course is meant to cement what you know. It should not be the only building that you have. So yeah, read your. So I did BJUI knowledge when I was preparing for part one the second time. I actually went and finished all the 400 modules that are there, and that is almost like a textbook. If you manage to finish all those, and they are good modules, they are actually really good modules, and a lot of them are written by Indian faculty. So
Okay,
I would suggest that if you have if you Oxford handbook you can read. It's not updated with the recent stuff. It's
exactly.
I think some years old now, but a lot of it is still asked, especially in part one. The percentages in that book are still asked. But I would recommend highly that you do BJUI knowledge at least once because there are many things you may not have seen. For example, resume, ITIND, although they are there in the BJUI knowledge, or if you practice it, that's fine. So
Okay,
just go through that once, do your course. If a candidate has done BJUI knowledge modules and he has done your course and maybe appeared for one UK mock exam or any mock exam where it's just to test you,
right.
then he should be fine. He should be fine because the beauty of your course is it's interactive and it simulates the exam scenarios and you give 10 minutes per discussion, which is what you will really see in the exam. Yeah, I would have done even better, maybe even got a gold medal if I had live participated in all your classes. The problem was I was a consultant and
Yeah, I
I
understand.
operate
So
on
that is why we are
Saturdays as
trying to
well.
provide recordings, and but I know the recordings can
Yes,
never be a substitute of the
exactly.
live classes.
No, exactly. If I had practiced speaking the way, with the time constraint timer always on, I would have probably done even better. But yes, your recordings, you were very kind and considerate to share your recordings. And that was my main source. I would credit your course to, majority of my success actually comes from your course.
Thank
Because even though you may know a lot, so knowledge is like only one third, of what they are assessing. So even though I may know many deep things because of the way I practice, the years of experience I have, but presentation and those things, this is what your course, two-thirds of the marks are exactly what your course will take someone through. And I
I think it's
strongly
very
suggest that.
difficult to remember a lot of things. So what is important is you should make some mnemonics, which is easy to remember when you're
Yeah,
sitting in front of the examiner.
yeah,
Certain things should, the keywords, like
yes,
keywords should come
exactly.
automatically. You should not be thinking a lot
Yes,
about the keywords. Okay, that
exactly.
should be very important.
And you taught all those in your course. You teach so many mnemonics. The questions that are asked as associated abnormalities with undescended testes, associated with hypospadias, and you have mnemonics for all these in your course, which is wonderful.
Yeah, thank you so
And
much.
yeah, I strongly recommend that more and more people should actually consider joining your course.
If you
Yes,
are in a group discussion, then definitely you are very
yes,
close to a colleague who is going to have the same knowledge and who you able to
exactly.
discuss it very frequently. And time-based
Yes,
discussion is very important. You should have a timer. Even your colleague should have a timer with you. You should not let you speak more
yes,
than 10 minutes. This is very important.
exactly. Yeah,
Being an
yeah,
examiner
and
is
your
also
course.
important. I think when you are discussing with your friend, you play the role of an examiner for 10 minutes, and that is very important. When you become an
Yes,
examiner, you
yes,
realize a lot of things. You realize
yes,
what questions can be asked, and yeah, being an examiner
yes,
is also equally important experience when you are preparing for
yes,
this. You'll understand when
yes.
you play the role of an examiner with your friend. This is very important.
I completely agree. Look, I mean, look, I am a proper consultant, but still, I fumbled so much in the exam. You never realize,
Yeah,
in that much of,
fumbling is definitely going to
yeah,
happen. You need to revise,
yeah,
practice, 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 and then the fumbling will come
exactly,
about
yeah,
30 seconds, and you will be able to speak very
yeah,
fluently. I think three
yeah.
months,
I
four
wish,
months is very sufficient. If
yeah,
you practice for 3 to 4 months continuously with a in a group, then
yeah.
sufficient.
Yes, I'm really thankful. I mean, even though I could not utilize the full potential of your course, but it was still enough for me to do fine and just come out.
So you did excellent.
So,
Congratulations once again. So we have your score, and it's much, much, much above the pass marks. Okay, so great,
yeah,
congratulations. And
thank
suddenly
you.
I got recall about this mock exam, and then I thought that you should also be thinking that I got the same score
Even
you got.
I'm surprised. When you gave me this mock exam score, I thought you were being lenient. But now I realize you were
No, this
properly
is what the
lenient.
exact examiners think the same way. I think it's not about
Yeah,
leniency.
yeah, yeah,
If you are okay,
yeah,
the basics are okay. The examiner is
yeah,
going to give you really good marks. They are
yeah,
your friends. They think you as your colleagues.
yeah.
They are not your enemies. They
Yeah,
are most of the examiners
yeah,
are very friendly and
yeah,
very. They
yeah,
are like a consultant. Some might have a very
yeah,
masked faces. They won't give you any expressions. Other have a smiling face and they
yeah,
can make your
yeah.
station very comfortable. So it's all upon the performance. So I think the 50% is preparation, 50% is performance. So if you prepare well, if
Yeah,
you
exactly.
can't perform, you won't pass. If you don't prepare well, you perform, again, it's very difficult to pass. You need to perform well, you need to prepare well. Both is important. Then only
Yeah,
you will
I
pass with the
completely
great
agree.
marks, like you.